This is Day a Minute with Ruckersville Hoffman. I am at the brand new facility in Seminole Square, just off of or opposite Blue Ridge Cafe, so I'm gonna have lunch after this. But anyway, interviewing for the urgent care. So I'm gonna have my mask on and I'm gonna ask the provider also to put a mask on so that we can have a conversation for 20 minutes. And then I probably will get back to you afterward. And this is the 13th of Friday, so wish me luck. Hi, how are you? Do you want to say your name or just your first name or where we are right now and that sort of thing?
I'm Kelsey Morris. I'm a family nurse practitioner, and we are at my clinic, Ruckersville Urgent Care.
And I'm so happy to be here because I'm a nurse, and I've always said to myself and my community wherever I live, I've been in Charlottesville for 20 years, I always wish there would be like an asthma clinic and a separate diabetic clinic, like, you know, it would say, like a sign that would say geriatric, you know, that people, because the population has gotten pretty big. How long have you been living in this area?
I was born in Charlottesville, and I have lived in Greene my whole life.
Okay, so I know about Greene County. I love the politics there. I mean, people who are in politics, a lot of times they're moms and pops. One of the principals of the school, I know them since they were a kid, because I've been here 20 years, so yeah, well, they were not kid, but they were a young adult. Starting out, you know what I'm saying? So people basically work hard here and they do get far, I think, because there's opportunity. But for healthcare, you know, it's almost like people don't know what's available and opportunity that can happen. So I'm so glad to see this urgent care. So what do you think is the main thing now that the population has grown so much? They have all these buildings and homes and stuff like that here on 29. How do you think that your urgent care is helping?
So right now we're seeing a lot of folks that are really trying to get same-day appointments, and they're having a hard time with that with their primary care offices because, like you said, the population has grown, complex medical diseases have changed, and their schedules are fully booked. So the great thing about my urgent care is that we can do those same-day appointments, we can do the walk-ins, and we can fill all those gaps. So I want to tell you, quite honestly, now that you mentioned like what is called morbidity. Most people my age have a lot of morbidity. They have a lot of challenges because as we age, and our genetics too, and then also the toxins that, you know, if we smoke and drink, whatever it's called, anyway, it catches up. And so our doctors are only going to be able to do so much. And then they try to put us on medication to keep our blood pressure and stuff like that. But then all of a sudden we have stresses in our life, and then diabetes kicks it, whatever. And so sometimes we just need somebody to take our blood pressure and our sugar. And that's kind of why I was thinking that like urgent cares are more like, do you have to go to the ER kind of places? Do you think that when you see patients? So I definitely think that having an urgent care available will cut down on ED volume. My background is mostly emergency room and urgent care, so that's where I started as a nurse. And then I graduated my master's program for family nurse practitioner, and I've been in urgent care ever since. And I definitely feel like a lot of the things that people would go to the emergency room for can be handled in urgent care. Obviously, there's still things that are very severe that have to go to the emergency room. And sometimes we can kind of help divert that traffic, so to speak, so we can take care of all the things that are minor and non-emergent. And if there are folks that come in the door that think that we can do something that they need and like we can't, then we can kind of say, you know, these are my concerns, this is why you should go to the emergency room, and at least that will cut down on the non-emergent things in the emergency room.
Even if you go see your family doctor, they may send you to the emergency room.
Yep, absolutely.
And the difference between, for instance, a hospital based emergency room and you guys is that I think, and can you talk more about it, but like they have the laboratories, they have the CAT scans, they have chest x-rays, they have basic things that can say if you need to be admitted to a hospital, as opposed to a doctor who can just basically do assessments, evaluations, intake. So the history of patients is really important, isn't it?
Oh, absolutely. I feel like the intake and the history is one of the most important pieces, because you learn all the parts leading up to the purpose of their visit, and then you pull in that assessment piece and kind of delineate where the severity of their illness is going, and that way you can kind of determine if they're treatable and safe outpatient, which is kind of like where we come in to try to fix and treat outpatient patients. And then those patients that do need, constant monitoring, IVs, daily labs, those are patients that we would send to the emergency room for possible admission.
Because they're unstable, and also sometimes people pass out in your office or whatever because they've gotten to the point where they couldn't see the provider, or they don't want to go to the emergency room, or they don't have any money to go to the emergency room. They don't want to be in debt, and people are losing their homes, and so anyway, it's a situation that is, I think, multiplying problems here in Virginia, or specifically in this part of Virginia, I think, because if the tax base doesn't meet the need for people to be able to afford their health insurance and all that kind of stuff, whatever it is, it's slowly being balanced out. But at this point, healthcare providers are having to take, I think, the brunt of the problems, because they have to be able to stabilize the person, be able to give them a plan of care, and do it basically almost without support from different other medical people who are specialized. Can you tell me a little bit about, like, beside being an ER specialty, as an urgent care provider, do you feel like you are giving, because you have the ability to give somebody a plan of care after they leave here, if they do have something that is stable, but it just needs to be sort of educated person to how to manage their care at home and that sort of thing? Can you give me the difference between that's what I mean, emergency care and urgent care, sort of where people can return home?
So part of why I really enjoy doing this job and being in urgent care is I have that really strong foundation in nursing, and I think that as nurses we excel in education, being able to kind of get to the level that the patient understands, so we can really explain all the nuts and the bolts and help them understand, like, the goals that we need for them and the goals for them to feel a little bit better. And then, like I said, that emergency room stuff, like, that's for things that are outside of what we can handle on a day-to-day. Things like heart attacks or strokes or severe anemia that need blood transfusions for, folks that need cardiac monitoring. All those things would be the difference between urgent care and the emergency room. Somebody who needs a constant monitor versus somebody who can come in, be seen, be treated, and then leave with a plan of care very similar to, like, folks that come in with flu. So we can treat flu, we can diagnose flu in the office, and then we give them, a 5 to 7 day monitoring period of what to look out for. And then those red flags, if they do happen, then those are the reasons for them to go to the emergency room.
So a lot of people, including very recently my carpenter, said he couldn't show up because he had to pick up his child from school. And then when he took him to the doctor, the child, he had a virus. And then he complains, the doctor always says he has a virus. And I said, well, there's a difference between a virus and a bacterial infection.
And if people knew that, they would really like the idea of a vaccine. That's really the only way to treat a virus, as opposed to when it becomes infected or inflamed after the virus hits. And then also the doctor knows whether if you have a high fever or not, if it's a virus, and also the symptoms, like how the child presents and that sort of thing. And then I was thinking to myself, does my carpenter understand me? Like when you talk to patients, how is it that you can give them the confidence? That's what I want to say.
So the great thing about the human body is that it's designed to fight viral illness. Antibiotics are very specific in treating very specific bacterial organisms. And if you have a virus and you take an antibiotic, you actually wipe out your good body bacteria because the antibiotics are non-selective. So it's really important that we make that distinguishment between viral illness versus bacterial illness. And that honestly is the best for the patient, because then they keep their good body bacteria, because viruses will not go away with an antibiotic. Your body's best defense against that is supportive care. And a lot of times that happens with hydration, Tylenol, Motrin, as long as you don't have any contraindications to taking those, and giving your body rest and letting it do its job.
What I said ultimately to my carpenter, but I also thought about that. Like, we have a history. I mean, my history as a kid was that we found this miracle antibiotic, and we were treating people for years and years, even giving them we were doing that in the hospital as nurses, hand sanitizing and all that sort of stuff. Actually, I want to tell you a funny story. So when I was a nurse student, we were wearing pink uniforms and nursing caps. And after I started in about a year, I was working for the Brooklyn, Coney Island Hospital. It was a city hospital. It was great because I was given like an internship from school for 6 months being supervised or whatever. But they were chronic people that came in, and we had really good interns and residents from different countries who were already doctors there and had a lot of experience. Anyway, so after about a year of being in the patient's area with my nursing cap, they told everybody, never come in with a cap again. And we said, what are you talking about? That's our, that's how we look. That's how they can distinguish us from being doctors or whatever. And they said, because your nursing cap, which you wear every day, is contaminating patients. So people have this misnomer about why nurses wear uniforms or not, and why doctors wear uniforms or not. But all of it has to do with carrying bacteria from one patient to the next inadvertently. So we have a lot of people wear scrubs because it's easier to wash them. There's been a lot of advancement, like 50 years. As you have come up, and I want to say you're a lot younger than me, but you're very wise already. And then I just want to say, do you feel like all these advancements in technology and medicine and vaccines and the mRNA, especially after the pandemic, the things we learned about SARS in Taiwan and how the labs in China were developed before we were, because of basically China makes our pharmaceuticals because of their advancement in their labs. And then we outsource a lot of our medicine because of that. Do you feel like that there's a lot of unknowns here when it comes to advancements in medicine and testing and things like that when you talk to your patients?
So the best thing about medicine is that we practice medicine, and we use that because we practice medicine.
We can stop, yeah. And I can start again. Okay. We edit. So what I wanted to say, or what you were saying, was basically you're talking about logistics, I guess. Like how you actually now decide when you're looking at a patient for the first time and you don't have any history or whatever, and how you're
reconciling whether or not this patient can go home is kind of like the same or different than being an ER doctor, right?
So it's just based off of their exam and their history, and if there's anything that's concerning, if there's something concerning going on that I feel like they need higher level of care, that's when I would say, I really am concerned about X, Y, and Z, and I think for that reason that we should send you to the ER. Otherwise, like I said, if it's something that we can handle, then I'm definitely happy to handle it and give them a fantastic, well-rounded plan of care to make them feel better.
And I thought about that when you were talking, is that when they go home, if they go home, do they have a support system? And also how they've been able to manage is something that you really don't know. Like, and here's how I felt as, practicing in different capacities for 45 years. So whether it be in the hospital, myself as a nurse, or as an administrator of the hospital, working with insurance companies, or later on I became a school nurse, which was really almost like being in the ER. And then later on I did here a medicine's home care, Medicare. And then I taught in the colleges a little bit. Anyway, so in all of that, what I came to the conclusion is, as a patient, is that it's really has to be specialized. Like, I don't think patients understand that. I didn't understand that. Like, I want everything to happen all at once, but you can't do everything. Am I right?
So in the state of Virginia, nurse practitioners can have an independent nurse practitioner license after you've fulfilled a duration of clinical hours and you have a medical doctor sign off on it. And I have had all of those hours, and my medical doctor that I worked with was happy to sign off, and he felt very confident in my capabilities. There obviously are a couple of things that nurse practitioners cannot do that a doctor can. Obviously, they can do all the things. But like I said, the biggest purpose here is really to bridge the gaps and kind of fill the holes, and all of those things are things that we can definitely take care of here.
One of my providers was a nurse practitioner, was great. I had a doctor in Virginia, who retired, and then I got this nurse practitioner, and I was like so happy. And here's why. As a nurse, for my own training, and it's not everybody, not every specialty, it's not every trade. I just was very lucky, and I got assessment training. I also took electives, on my own, because I wanted to be able to help people, and not just send them out, in terms of like actually doing, cardiac, taking my stethoscope, knowing where to listen, how to listen, to the intestinal sounds, if there was gurgling or not, all that stuff takes, training, and then also being able to hear the differences. If a patient is obese, how do you what spots can you listen to if you have to listen, and that sort of thing. And also, if a patient is really, really not obese and is frail and has osteoarthritis and this and that, all these different things, you have to, with experience, you can, understand how to listen, but mostly nurses do that. I noticed. It's that we train to be hands-on, where I find that a lot of physicians are more technical. They rely more on the lab results and medicine, and the traditional way that medicine works. Can you explain if I'm saying something that's not true?
Well, I can't speak to any doctor training, obviously, because I'm not a doctor. But as a nurse practitioner, I was at the bedside first for a nurse for 6 years. And I think that being, a 12-hour on, 12-hour off caretaker with those patients, you get very familiar with them, and you learn different ways to do those deep, good assessments and ask the hard questions. And that's why I love what I do, and that's why I feel like I'm really good at doing that, because I care about my patients, on a different level. And I feel like that's why they are really satisfied when they come here at Ruckersville Urgent Care to get care, because I sit down with them, I talk to them, I never rush any of my patients, and I try really hard to figure out what's going on. And I think that they really appreciate that.
And I appreciate you so much, and that's why I'm here today, because first of all, how did you or whoever put this together get the courage and also the passion, compassion rather, to do this? Can you tell me a little bit about the history of you and being here and this and that?
Absolutely. So, like I said, I was born, at Martha Jefferson Hospital in 1993, and then I've lived in Greene my entire life. I graduated from William Monroe, and then I went to get my bachelor's degree at Shenandoah University in Winchester, and then I worked as the bedside nurse for 6 years, and then in that time I went back to get my nurse practitioner degree, which is a master's of science in nursing through Simmons University, which is out of Boston, Massachusetts. And then I started working as a nurse practitioner, and I've done that for the last 5 years. And I have been in urgent cares and family medicine. I did some geriatrics. So I tried to make sure that I got a little bit of everything. And then, I worked in other counties. So I've worked in Harrisonburg, Culpeper, Orange, Charlottesville. And then I decided, there's nothing in Greene, so why don't I come back to my own hometown and fill that void and fill that gap. And with some family support and love, we have created Ruckersville Urgent Care.
Well, thank you so much and I know you have to go back, so I just appreciate you so much and this facility so much, and I wish all the support in the world. And I will have this on YouTube and also public access so that people know how this has blossomed, and also to come and support it as much as they can.
Absolutely. We're happy to see anybody who comes in, and I'll do my very best to make them feel better.
Well, thank you so much.
Of course. Thank you.
And there it is. This is the logistics of where we are today. And then also, I just noticed something which I should have asked the nurse practitioner. This is also the, let me see, I'm gonna come back here and talk about it. Heartstone Family Medicine with Cynthia Richards.
And I'm not far enough for the stuff that keeps me up. What happens to you when you're under the gun and no one helps you out? Rain comes down, it's like a wave. Dreams occur and you can't tame, so you reach out to the line to pull you in. Yeah, you reach out. You're sinking in. Yeah, you reach out for safety, coming from the rain. It's like a wave. It's like a wave. It's like a wave. It's like a. And it's okay if you don't win.